the basics of the SEEK. In this video, we will cover what is the safe environment for every kid, or SEEK, who and when to screen with the SEEK, why you should screen for barriers to health with the SEEK, considerations for implementing the SEEK into your practice, and where you can learn more about the SEEK and screening for barriers to health. What is it? SEEK stands for Safe Environment for Every Kid, which is a screener for social determinants of health or barriers to health. The SEEK has scaled fees depending upon the number of providers using it in a clinic and whether it is a training environment. The SEEK is available in English, Spanish, Chinese, and Vietnamese. The SEEK measures multiple barriers to health, including parental depression, parental substance abuse, major parental stress, intimate partner violence, food insecurity, and harsh punishment. Who and when to screen with the SEEK. The American Academy of Pediatrics indicates that screening for social determinants of health or barriers to health is recommended to be conducted at any well-child visit from birth to 5 years as a part of the psychosocial behavioral assessment. However, the Louisiana Developmental Screening Guidelines recommend specific visits for barriers to health screening. The Louisiana Developmental Screening Guidelines recommend screening at the 1, 2, 4, and 6-month well-child visits, as well as annually at 12, 24, 36, 48, and 60 months. Importantly, SEEK is designed to be completed by caregivers and is not age-dependent. Why you should screen for barriers to health or social determinants of health. Unfortunately, Louisiana ranks 50th out of the states for child poverty, as 28% of Louisiana children live at or below the federal poverty line. Providers who screen for barriers to health are in a unique position to make referrals and connect families to resources such as food assistance. Evidence from providers who have implemented the SEEK show that families who have been screened with the SEEK were less likely to be referred to child welfare services than those who were not over a 3-year period. Moreover, parents who completed SEEK screens had a more positive view of their primary care provider than those who did not. Taken together, SEEK not only provides contextual information about the child and family, but opportunities for learning, deeper understanding, and connecting children and families with the resources they need to thrive. Here are some things to consider when implementing the SEEK into your practice. Due to the sensitive nature of many of the questions in the SEEK, caregivers should always complete the screen in the exam room to be handed out by medical assistants or nurses. Fortunately, scoring is quick and takes about 2 to 3 minutes and can be done by MAs and nurses. Similarly, discussion should always occur in the exam room between the primary health care provider and the caregiver. Fortunately, the SEEK has specific algorithms for addressing barriers to health. The algorithms can be customized to include referral resources that are local to your area. The SEEK is also able to work well with some medical software and has been integrated into Citations and Phreesia, which then integrate into many electronic medical and health record systems. Where you can learn more information about the SEEK. Check out our videos on how to score the SEEK and using developmental screening resource guides with families, where we have region-specific guides on family wellness that addresses many of the topics covered in a SEEK screening and more. You can also check out the description box below for important links, such as our Barriers to Health training page, which is a part of the Developmental Screening Online Toolkit, the SEEK website, and the link to continuing medical education for SEEK training specifically for pediatricians and family medicine providers.